If you've ever iced a swollen ankle or reached for a pain reliever after an injury, you've seen your body's inflammatory response in action. And most of us are taught to treat inflammation like the enemy, something to be stopped or controlled immediately. But it's actually your body's brilliant first responder. Think of it as a controlled fire that needs to burn just long enough to clear out the damage so that rebuilding can begin. Today, I'm going to show you how to work with this natural process so you can support your body and get back to moving comfortably faster. Inflammation is like a controlled burn. So this is how the body clears out debris from damaged tissue so new construction can begin. So here we have an image representing the 5 cardinal signs of inflammation. And those signs are heat, represented by this gentleman with the thermometer in his mouth, redness, swelling, pain, and loss of function. These are like the construction crew that shows up to manage the fire. And in clinic, we look for these 5 characters. They're not there to annoy you. They're actually the crew that is working on that healing fire process. So these 5 cardinal signs of inflammation are triggered by infection or tissue irritation that sends out chemical messengers to allow increased blood flow into that area of irritation or tissue damage. So it used to be the classic management for inflammation was RICE or PRICE method. Those are acronyms PRICE or just RICE, which stands for rest, ice, compression, elevation. The P added is just protection, so some kind of splint or wrap. And that was developed in the late 70s. And now in the literature, it's actually showing that that particular simplified way of managing things might not be the most effective. The ice can actually cause narrowing of the blood vessels and slows the tissue activity in the area. So that can slow down the arrival of those healing cells, potentially delaying long-term injury repair. The original physician who coined the RICE term in 1978, Dr. Gabe Merkin, he has actually now recanted it. So we have a new system proposed in the literature. First time it was mentioned was in the British Medical Journal, and that is peace and love, kind of like the sound of that, right? So let's go through that. This graphic is representing the new management process for tissue injury management. So we have peace and love, and they're also acronyms. Peace stands for protection, elevation. A is avoiding anti-inflammatories. So we don't want to silence the repair crew. C is compression, and E, the last E, is education, to understand the injury process and what helps. And then love is actually after the initial onset of the injury. We're going to add loading, gradually increasing the tissue activity and loading, optimism for a positive mindset and supportive healing. V is vascularization, which just means we're going to make sure that we have good blood flow to deliver those nutrients and cells to the area for repair. And E is for exercise, to restore movement. And again, this peace and love mechanism was proposed in the British Medical Journal in 2020. So the peace part is for the initial onset. You'll notice that some of the components are the same as the rice with the compression and elevation, and also the P is for protection, but we've added some other things with the avoiding anti-inflammatories and the second E for education. Love is the subsequent portion. That's going to be during the healing phase. And so this doesn't mean that ice and heat are never appropriate. It just means that we don't want to use excessive amounts because we definitely don't want to impede the healing process. In the acute stage, we can use ice 10 to 15 minutes. Heat is more appropriate in chronic situations. It can actually help with loosening up muscle stiffness and joint tightness, maybe 20 to 30 minutes. We can do it before exercise. As you'll see, we're going to talk about some exercise recommendations. In the chronic phase or the healing phase, we can actually use heat to prepare the tissue for activity. So we're going to start with specific movement, just gentle range of motion activity. And this should start as soon as possible after the injury. Of course, we want to assess and make sure that the tissue is stable. If it's not, well, first of all, that's not a thing that you should be trying to manage at home. If it's not stable, it needs to be evaluated by a professional and the degree of instability assessed. So our at-home suggestions are based on the premise that it's stable. So we're going to just start with nice, gentle, easy movement in the normal ranges of motion. And then we're gradually going to add loading, a little bit of resistance. Exercise bands are wonderful for this, and they come in all different strengths. So you have really, really easy bands, and then the ones usually, no matter what brand it is, usually the ones that are heavier, tougher bands are black or gray color. So in my office, I have the ones that are kind of mid-range so that it can work for a variety of people. You start with just movement, and then you're going to gradually increase your resistance. I've used things like the exercise bands. Also, balance board is a great thing, or at home, you probably don't have a balance board. You can do single leg stances. And of course, it depends on what particular type of injury you have, what sort of loading you're going to be doing. Nutritional support is also important. Any kind of sweets or grains can actually increase inflammation. You want to make sure that your fatty acid profile is balanced. Usually that requires supplementing with some omega-3s because our diet is usually overloaded with omega-6s, and that imbalance can push you towards increased inflammation. Enzymes from pineapple and papaya are wonderful. I think I've mentioned in a previous video that one of my patients has an anti-inflammatory smoothie that she likes to make with pineapple and papaya. You can also add ginger and turmeric. Turmeric's probably going to be a strong flavor in the pineapple and papaya smoothie, but you can add that as well. If you add turmeric, turmeric is a wonderful anti-inflammatory, but the active component in turmeric is curcumin, and curcumin is fat soluble and it's tough to absorb. So make sure you take it with some fat, and it also is better used when you have some black pepper with it. So the components in the black pepper help that curcumin active component to work better. So again, to recap, the enzymes in pineapple and papaya, ginger, turmeric, remember about fat soluble and adding black pepper. There's recipes online for something called golden paste, where you mix the turmeric with black pepper and coconut oil and make this paste that you can add to your foods and so forth. And that's a good way to do it to make sure they can all work together. If you have any kind of sugar problems, pineapple and papaya is probably not going to be a great choice. They are super delicious, but they are also some of the highest sugar fruits that there are. You can get those enzymes actually in tablet form at any of your natural food retailers. They usually call them digestive enzymes. The actives are bromelain and papain. And so you could take those in tablet form. Again, limit sugar and grains. And make sure that if you have an injury with significant swelling, certainly any kind of loss of movement, bleeding, numbness, tingling, or if you have lack of improvement or progression of symptoms, that certainly would necessitate a trip to a professional. Remember, if you have any kind of conditions related to inflammation or joint problems, you definitely want to seek assistance from your provider. A video on the internet does not substitute for specific personalized healthcare advice. So, chronic inflammation is a different sort of situation than what we're talking about here with inflammation related to injury. And so we're going to be talking about that in a future video and how it can affect other body systems, like, for example, the cardiovascular system and the heart. So stay tuned for those upcoming episodes. Please place in the comments any questions or ideas you have for future videos that you might want to see. Remember to like and subscribe, and I'll see you in the next one.